Okay, back rehab. There's two different trains of thought when you're dealing with back pain or back rehab. There's Williams or Watkins versus McKenzie. Both agree that the origin of back pain most oftenly is a disc involvement. So if you're dealing with any type of spine injury, this is not a musculoskeletal issue. This is a skeletal issue. It only does not necessarily involve the muscles for the injury purposes. The injury is at the disc. Now, it's basically the decision between is it a flexion problem or an extension problem. Williams focuses on the lack of flexion in the general population and blames that on back pain on standing too much. Basically, because of our reduced amount of flexion and movement in our spine, because we stand and are erect humans, that is why we have pain. McKenzie, on the other hand, likes to focus on increasing extension and blames back pain to prolonged sitting most often. So Williams flexion exercises, it's what you've probably seen, which is like a pelvic tilt, where you lie on your back and you work on the flexion of the core, your abs. Single knee to chest, a lot of core work, abdominal work, double knees to chest. So notice this is all flexion exercises, so we're working on the front. It's the most commonly thought of and used exercises, I will tell you that. But this is just some of them. There's more. There's partial sit-up, hamstring stretch, hip flexor stretch, and squatting. Here's some other simple back stretches and back exercises people can do: quadruped or cat-camel stretches, standing hamstrings. Because our hamstrings are tight, then it's going to pull on our glutes, which is going to pull on our back, which is going to cause pain. I would say most oftenly, is that a word? Most often, it is more of a stretched abdominal side or wall, meaning you need to strengthen the abs and stretch the back muscles. That's the most commonly seen diagnosis, simply because of how people are built. If you watch people stand, most oftenly they'll stand like with their legs locked out, their stomach almost kind of sticking out with excessive extension, increased lordotic curve. If they have that increased lordotic curve, they have excessive extension, meaning those muscles need to stretch in the back and strengthen in the abs to pull yourself back into alignment. There is a whole progression through Williams-Watkins, and honestly, I have a chart that looks just like this with level 1, level 2, level 3, level 4, level 5 for all the exact same exercises. Okay, so level, A right there is dead bugs. Level 1, you support, the arms are supported and you're just marching your feet. Level 2, our arms are unsupported and now we're extending our feet. So they get harder and harder as it goes down the line. When you're working with a patient, you want to accomplish all of these exercises. However, they may be in different levels on each exercise, and that's okay. That's fine. McKenzie exercises. These are more of the extension exercises, remember? So we're going to be working on lifting up from our stomach and working on those extensors, those back extensors. Also, they bring similar, they're stretching also as well. I realize the visual of this is a little bit hard to see, but those are the primary stretches and exercises. I will attach in the module as well a list and a packet of all the different back exercises and how they progress from dead bugs, partial sit-ups, to bridges, to on the ball, to quadruped exercises, so you can visually see all the progression as well as be able to try them and see if they're hard, easy, where you fit in within all of this.